Hello and welcome to Community Conversations. I'm your host, Steve Mantis, and today my guest is Matt Shaw. Matt is an occupational therapist, and in the interest of full disclosure, he's my occupational therapist, or one of the many really healthcare workers that support me in living an active life after I've lost my arm, which was 36 years ago. Welcome to the show, Matt.
Thank you, Steve. Good to see you again.
Yeah. So, Matt, let's start a little bit just with your own background. Tell us a little bit about your early life and how you ended up working as an occupational therapist.
Yeah, so I'm originally from Timmins, so I'm a Northern Ontario boy.
All right.
I went to school at the University of Western Ontario, and so I took my OT degree there. And it was in my last internship at University Hospital where I really got interested in treating hand and upper limb injured patients. We worked closely with surgeons. University Hospital was a regional facility, so we saw a number of especially hand-related injuries. And I found that it was an interesting kind of field of speciality for me. And then when my wife and I decided to move back to Northern Ontario, the Ministry of Health had me visit different communities in Northern Ontario, and we settled in on Thunder Bay. We loved Thunder Bay right from the get-go, and so I've been practicing, and my wife and I have raised our kids here for the past 23 years.
Well, we're sure glad that you settled here in Thunder Bay, because I think you had a real significant contribution.
Yeah,
now, tell us a little bit about occupational therapy and occupational therapists. What the heck do you guys do anyways?
Occupational therapy is quite a broad profession in terms of the types of clients that we see. So you may find OTs working at George Jeffries, working in pediatrics. You'll find OTs in the hospitals working on medical floors or post-surgical floors. My particular area of expertise is in hand and upper limb rehab, and it's traditionally OTs and physiotherapists deal with post-traumatic rehabilitation for hand, wrist, elbow, and shoulder injuries. This happens to be Occupational Therapy Awareness Month in October. And so I think you'll find OTs in different fields. We're not probably as well known as physiotherapists. In our field, though, probably 2/3 of certified hand therapists and therapists dealing with the upper limb are OTs. So it seems to be a speciality that attracts us for some reason.
And so the name occupational therapy, I think the occupational piece is, as you say, it's a broad field,
Yes.
but I guess there's a certain number of folks that really practice around the relationship between the work and the workplace and people's physical challenges, I guess.
Well, for sure, a great number of our clients, our patients who have injuries to their shoulder, for instance, they've incurred this injury because of their work tasks that they have to do. When you reach 40, if you're doing any kind of manual labor, you're prone to having degenerative changes in your shoulder, rotator cuff disorders, that sort of thing. So I think when we talk about occupation, we usually refer to any activity, so something that occupies you, and it's usually functionally based. OTs deal with regaining function a lot of the time. And of course, our upper limbs are very important in terms of maintaining and regaining function. And we stress long-term health and independence with people. So the stakes are often quite high. Someone who comes to see us after a rotator cuff repair, for instance, there's some loss of function, even in the best outcomes after our talented surgeons have repaired them and they've had extensive rehab. just by the nature of the demands placed upon a shoulder, that can be a lifelong injury that people have to deal with.
Well, okay, so thinking about the shoulder, you brought a little model of a shoulder. Just show us a little bit. What makes the shoulder unusual and prone to injury?
Well, I'd say that this is a very complex joint to the body for sure, but just to simplify it, the dimensions of the shoulder joint itself is similar to a golf ball sitting on a tee. So it's naturally an unstable articulation or joint in the body. Unlike the knee, which is more of a hinge joint, this joint has 360 degrees of motion, and it's attached to a fairly long lever arm. So the longer the lever, of course, the more stress is at the fulcrum of that lever. What stabilizes this joint are a number of soft tissue structures like ligaments, a capsule. These rotator cuff muscles here that I'm showing here are basically your steering mechanism. The bigger shoulder muscles that lay on top, like your deltoid, your trapezius muscle, your chest muscles, are the motor behind the shoulder. These rotator cuff muscles act like the steering mechanism. So they're under tension whenever you're reaching away or above your head, or whenever there's any traction. For instance, when you're lifting, your rotator cuff muscles have to be strong and healthy. And they are also the most prone to injury. Just because of the long lever arm on this unstable joint, there's quite a bit of force on these 4 rotator cuff muscles.
So I mean, you know, when you say like a golf ball on a tee, there's not much holding it there, right?
No, how often have you teed up a ball and had it fall off 2 or 3 times?
Yes.
So these rotator cuff muscles are meant to create stability, but it's also a source of strain. The supraspinatus muscle is meant to abduct or lift the shoulder to the side, but it also helps keep the head of the shoulder on that tee, in the center of that glenoid. And so probably 90% of the time, this is the tendon that's torn. When it's torn, there are a few things you can do. Occasionally, if it's just partially torn, rest, proper stretching, education around avoiding things that make it worse can help the shoulder regain function. If it's a bad tear and it requires surgery, then it's a lengthy rehab process. And that's part of what OTs and physios will help you with if you have to go through the surgical stage.
Well, Matt, we're just going to take a little break. I want to come back and explore who might be getting injured or experience those problems. Please stay with us and we'll be right back.